Hello, everyone. My name is Stephen Lott, and I'm the Senior Lead of Communications for the McMaster Health Forum. It's my pleasure to welcome you to today's COVID-19 webinar on tackling COVID-19 misinformation shared via WhatsApp. I will introduce today's speakers shortly, but before I do so, I'd like to invite Lawrence Langer to provide a brief overview of COVID-19.
A warm welcome from me too. I'm Lawrence, and together with Maureen Dobbins, I co-chair the Engagement Working Group. And I know you're here to hear about our lovely presentation. And I'll just give you a very, very brief introduction to COVID and itself as a network. And I promise to not keep you too long. So what are we really at COVID-End? So we are a time-limited network who came together, I think, about a year ago. So we had recently our anniversary to see how can we support the use of evidence during the pandemic, and in two ways really: to support decision makers in finding and accessing evidence, and then also to support researchers to maybe not duplicate and put the few resources that we have into the similar areas in the pandemic. And I think in the overall remit of how can we coordinate this evidence ecosystem in the times of COVID a bit better. And so, as I said, about a year ago, we started reaching out, and a really exciting group of people and organizations since has come together. And we have now over 50 plus members in our network, and they really range a really broad area of groups, from evidence synthesis organizations to technology assessment and guidelines group. And between us, we cover a fairly broad spectrum of different ways of responding to the pandemic. So we have experts on public health, experts on social systems, and we also spread quite fairly around the globe with groups in high income and low and middle income countries. And yeah, so it's a fairly diverse bunch of organizations. Next slide, please. Yeah, and here you have a little snapshot. And yes, this is not exhaustive, but I hope it gives you a little bit of a feel of who makes up COVID-End. Next slide, please. And yeah, so if you want to know a little bit more about COVID-End itself, our network, we have a lovely website that I'd encourage you to have a look at. You'll find quite a few resources there, from an inventory of the best available evidence synthesis to a horizon scan. And you'll also find a little bit more information on the COVID-End working group itself, and particularly the community of those supporting decision-making during COVID, which we do support through our specific working group. And if you want to deep dive quite a bit into this, we have a listserv that you can join, where we discuss recent topics around COVID-End, and where we also advertise additional resources and topics for discussion. And one of the key things that we're doing are these monthly webinars, where we have specific topics to untangle in a little bit more detail, and this is one of them. So if you're interested in these, you can either reach out to us on email or also get in touch on Twitter, and the link to join the listserv itself is here too. And next slide, please. Yeah, and just to also acknowledge our funders who make this work possible, ranging from the Government of Ontario to the National Institute of Health Research, individual donors, and also the Canadian Institute of Health Research. So with that, I hope that gives a bit of an idea what COVID-End might be, and I encourage you to now listen to our brilliant presenters.
That's great. Thanks so much, Lawrence. Before we begin, I wanted to note that there will be an opportunity for questions and answers later. Please use the chat box to ask your questions or share comments during the presentation. Also, if you have any feedback after today's event, please email us at covidend@mcmaster.ca. We have two great speakers joining us today. Nukulu Leko is a researcher at ACE. He holds an MCOM in Developing Economics from the University of Johannesburg and is currently pursuing a second MCOM in Competition and Economic Regulation. His research interests broadly include competition and regulatory economics, labor economics, resource economics, and macroeconomic policy. Through his research, he aims to contribute to relevant socioeconomic dialogue and policy change in the developing world, with the broader aims of poverty alleviation and more equitable resource distribution. His current role at ACE is in evidence synthesis application in the wider social sciences spectrum. He has worked on different types of evidence synthesis, including an evidence map and rapid synthesis on land reform for the Presidential Advisory Panel on Land Reform and Agriculture, and currently leads the ACE team on supporting the International Initiative for Impact Evaluation on various systematic reviews and evidence maps in the areas of digital health, gender equality, food systems, and social cohesion. I'd also like to welcome Andil who holds a BA honors degree in development studies from the University of Johannesburg. She is currently pursuing her MA philosophy degree in gender studies. Her current research is on feminist hashtag activism and how the digital world affects the status quo in real life. She works as a research assistant with the evidence synthesis portfolio at ACE. Her work includes consolidating resources from different sources into one product that is easy to navigate. She has done a lot of community work and believes that evidence-informed decisions can bring about effective change in the lives of people. Please welcome them both.
Thank you very much, Stephen. Apologies. Thank you very much, Stephen. Greetings from a very volatile Johannesburg in South Africa. We welcome all of you from all over the world, hopefully. And thank you for the time you've taken to join our webinar today. We're presenting some research that we've done on tackling COVID-19 misinformation, just shared via WhatsApp. This is my colleague Andile, as well as myself. And we actually executed this research with a much bigger team in the background, including Ruth Stewart, Linda Etale, Nicola Tienason, and Evan Manyukisa. Quite a big team, but good work done. So I think really to start off with, next slide, please. To start off with, I would like to give a bit of an overview of what ACE is and what ACE does. We're essentially a research organization that's based at UJ, the University of Johannesburg, in South Africa, of course. And we were formally established in 2016, but we've gone under various names, most notably UJ's BCure program, which was the Building Capacity to Use Research Evidence program. And essentially, really, our vision and mission are centered around these goals of poverty and inequality reduction. And because of this, really, we've tried to set ourselves up according to 4 strategic goals, which relate to understanding better the art and science of using evidence, better evidence capacities, meaningful evidence communities, as well as rigorous and relevant evidence synthesis. Essentially, that's what ACE does as an organization. And I suppose quite importantly, we also align our work to the National Development Plan in South Africa, as well as the SDGs on a more global scale. Next slide, please. So to introduce this research, it's always challenging having to work out some background on this COVID-19 pandemic. But as we would all know, it's altered many facets of our lives, essentially in how we interact and interact with each other as well as with information, actually. So misinformation about this pandemic actually threatens to impact efforts negatively in terms of reducing or curtailing the spread of COVID-19, as well as undermining the global healthcare system. And from what we know, platforms like, and these are called kind of dark social media platforms, like WhatsApp, where messages are encrypted or hidden, or kind of where it's difficult to, or where there aren't any current mechanisms to track messages that may have misinformation. They remain a challenge for fact-checking and verification. It makes the environment itself quite rife for the spread of misinformation and just blatant false information, which has been coming out quite a bit over the past year or so. And of course, because it's so widely used across Africa to communicate and access information, it may be misused kind of as a channel through which people can spread misinformation. So to this end, really, what this research kind of proposes, and the vantage point from which we look at this, is countering the spread of misinformation is essential in terms of helping to design effective strategies to curb this infodemic across the continents as well as globally. There are so many lessons to learn from emerging research. So this is currently where we kind of locate this piece of research. It's also an attempt really to provide relevant evidence through a very multifaceted research approach, which answers a few pertinent questions. I think important to note here as well is our partner on this project, Africa Check, which is essentially a fact-checking organization, as well as CAS from Germany, which is, you know, the political foundation essentially that advances for democracy, as well as, you know, the formulation of opinions. It's quite amazing that such organizations are beginning to have some kind of appetite for work of this nature. It's extremely encouraging, and it's been amazing to work on this. Next slide, please. So in terms of the research approaches and just a general summary of the kind of research questions we undertook, we wanted to focus on what the nature of misinformation is. As a first question over there, we wanted to focus on what the nature of misinformation on COVID-19 shared across WhatsApp in Africa, and what level of risk does it present. That would be our first question. Our second is relates to user responses, how these users are responding to the public health and misinformation on WhatsApp. And finally, how can we better respond to the risks that misinformation presents to help tackle the pandemic. So quite a bit from there in terms of formulating lessons as well, identifying risks and formulating lessons that can actually help in curbing the spread of misinformation. And in terms of research countries, there's particular emphasis on South Africa, Senegal, Nigeria, as well as Kenya, but with relevance to all of Africa, really, and the world over. At the moment, given that the pandemic is affecting us globally, we unfortunately can't really pick and choose what we're affected by. So misinformation is definitely a shared responsibility in terms of finding solutions around it. It's a shared responsibility globally. And this is currently the focus of our research in this instance. Next slide, please. So in terms of the research design, to give I suppose an overview, really, we expound more on that in the next slide regarding these methods. But essentially, the kind of approach that we've used is, as I said, quite multi-pronged. You know, quite a few layers to this. But essentially, we start with some trend analysis of misinformation reported to Africa Check for the 3 months between April and June of 2020. We also have rapid evidence assessments, which were an important part of this work, and which were quite interesting to apply in this context. We also have a survey that we ran on WhatsApp users across the continent. Also quite interesting there in terms of accessing these users in their native languages, notably French. We've also got interviews with fact checkers working in Africa, and we also develop a risk framework. So really trying to be as thorough as possible, trying to use or trying to really maximize the resources at our disposal with this research. Next slide, please. And of course, to just kind of reinforce the points made in the previous slide, quite a bit of this work really, or should I say, quite a bit of number one there, the rapid evidence assessment borrows from traditional systematic review methodology in terms of the steps, you know, the searching, the screening, and the analysis. So in terms of our searching, we looked at quite a few things there in the traditional academic literature from EBSCOhost, PubMed, as well as the UCT database. Grey literature is also quite broad. Quite a few organizations were looked at here, sector-wide organizations, Congo Check, Africa Check, Dubawa, Zimfact. And in terms of the master hub searches there, actually, we used COVID-19 as well as the Living Hub of Hubs that was recently launched as well. Or, you know, it's been a lot of work that's been going over the past year, really impressive sources of information as well. And if we look at the screening step or the screening component, we did traditional title and abstract screening as well as full text screening. And for the analysis itself, it helped to extract themes for these strategies in terms of how misinformation and the spread thereof is mitigated. In terms of our second method, the survey that was conducted, It was an electronic survey on Google Forms. It was a range of closed as well as open-ended responses or questions. And it was both in English and French to really tap into some of the Francophone countries, because there was quite a wealth of responses coming out of there as well. And of course, ethics approval was granted by the Research Ethics Committee at the University of Johannesburg under the Faculty of Humanities. And in terms of the trend analysis of misinformation reported, we analyzed the information or data on misinformation that was reported over this 3-month period, as we've outlined. And the fourth method that we'd like to outline as well is based on the interviews with the fact checkers working across Africa. We aim to really uncover sources of misinformation and current strategies and the involvement of influential individuals, such as religious leaders, for instance. So in other words, what kind of strategies might be applied, and what do these individuals know about this plight of misinformation spread. And finally, we did develop a risk framework there at the bottom, and we attempted to really classify risks which were associated with health misinformation. Next slide, please. And really just a point, I guess, on the rapid evidence assessments as well as systematic review methodology. Oftentimes when you embark on a systematic review journey, there's the process of searching out, collecting, reading, combining all the available research on a given topic. But you're met with a lot of obstacles, in the sense that it becomes cumbersome. It's a very laborious process. You require really specialist methodological skills and advice, topic expertise. Typically it could take you around a year with a team of 2 or 3 people to execute. And it typically results in a long and detailed report. And of course, it also, there's also, particularly in the time of a pandemic, the issues of timeliness, completeness, and relevance. So when we embarked on this journey, in as much as we understand the significance of the systematic review methodology and the type of contribution that it has towards answering the 3 questions we've outlined, it was also quite pleasing that we managed to use the other methods as well, because it creates a process for learning that allows you to use different angles to understand how people are dealing with misinformation on a daily basis, how people are dealing with COVID itself on a daily basis. So really amazing to have been a part of such a rich methodological approach in terms of finding the answers to our questions. At this moment, I would like to pass over to my colleague, Andile, who will go through some of the findings, which will be interesting for discussion. Thank you.
Thank you, Nkululeko, and hello, everyone. Thank you, Nkululeko, for taking us through the background and the methods that we used. And I will now take us through the findings. And now the findings are structured according to the research questions discussed by Nkululeko earlier on. And the first finding is around the nature of misinformation and the level of risk presented by misinformation. The analysis of misinformation claims which were reported to Africa Check revealed that there are 4 types of risks. And misinformation claims which were flagged as harm to physical health were mostly false cures. So this includes natural remedies, herbal cures, and everyday cures. And misinformation claims which were flagged as economic harm include claims for job opportunities in the World Health Organization or the UN, and particularly to South Africa, there was misinformation offering users a form of social relief, and there were some claims which encourage panic buying. Now, a lot of conspiracy theories thrived on WhatsApp. Conspiracy theories around, the classic COVID-19 conspiracy theory of the 5G causing COVID-19, COVID-19 being a biochemical weapon from China, and vaccination conspiracies. One social harm claim which would be the conspiracy around COVID-19 being a cruel strategy by the West against Africans. Next slide, please. So now the harms caused by misinformation are categorized according to a framework we developed. I think Nkululeko did touch on this a bit. And the evidence revealed that physical harm caused by misinformation can vary from poisoning as a result of swallowing or injecting bleach to hospital admission and death as a result of methanol overdosing. Studies described economic harm such as stockpiling food because of the fear about food scarcity. And there was one particular study which recorded a case where a 5G tower was destroyed because the people around that area believed that that particular tower was causing COVID in that area. And social harm due to misinformation includes reports of xenophobia towards Chinese people because of the belief that the COVID-19 virus was a Chinese virus. And this also links really to the political harm caused by misinformation that resulted in a negative association with China because of the apparent source of the virus. And studies also revealed that there's a strong association between panic and the use of social media. And studies also reported high levels of depression, which were associated with COVID-19 information on social media. Next slide, please. Okay, the second finding was around user behavior. We set to understand how users respond to misinformation. The evidence base revealed that now user behavior patterns do in fact lead to the spread of misinformation. What we discovered is that we found very few people actively critique or report misinformation. Rather, most of the time, social media users appear to just delete the message they think is misinformation, ignore it, or just share it anyway. And some users actually act on that particular misinformation. Next slide, please. And we also looked into the motivations behind different responses of users. And we found that the type of content influences user response. So some people shared the 5G conspiracy theory because they thought it was funny. So it's not so much that they actually believed it, but they thought it was such a funny conspiracy theory that they shared it. And in that way, it actually gained traction instead of, it would have been better if they had reported the message or something like that, but rather they would share it just as jokes. And we also found that some people share information to be helpful. We discovered a very strong theme where people felt the responsibility to help those in their circle. So if I come across a piece of information around a cure, I'd definitely try to share it with other people because I'm trying to be helpful. And then some user behavior is shaped by who had shared the information with them. So if a close friend had shared the message, that particular message with me, I'd be more inclined to believe it, to act on it, and to also share it with others. Same with maybe if it's a government source or a legitimate news source. The emotions triggered also influences response because if it's good news, for example, maybe I get a message that the government is about to increase the social security grant. Those are great news, and I would like to share those news with everyone, and I'm more likely to believe it, and I'm more likely to act on it, because now if maybe the message says to get the grant, I'd have to go to a particular department, I'd be more inclined to go to the particular department. And also, there are some people who just trust information on social media to be true. And then there's a specific group of people who have cyberchondria. Those are people who are overly stressed and anxious about their health. So if they come across anything on social media that has to do with health information, they're more inclined to act on that particular information. and to share it with others as well. And there was an idea around conformity. So now if in my circle of friends, everyone believes that vaccinations will kill us, I won't be an outlier and not agree with them, but I'd be more inclined to agree with them and just share that conversation and engage in that conversation as well. Next slide, please. The third and final finding is around mitigating strategies. Our rapid evidence assessment identified 9 mitigating strategies which counter health misinformation on social media. The first mitigating strategy is around having more credible information over misinformation. So this would be meaning that we flood social media platforms with correct information so that misinformation does not have that much traction as compared to credible information. The second one would be promoting a self-efficacy to detect information. This has to do with actually teaching users to be able to detect misinformation. And the third one was around making misinformation illegal, infovariance, technical solution debunking, social media companies tackling misinformation in their platforms. I think this is a common one on Facebook and Twitter. But not so. It's not very. It's not so easy to implement with WhatsApp. But I think what we've noticed is that if you forward a message on WhatsApp, it shows that this message is actually forwarded, and you can't forward a message more than 5 times. So those type of initiatives, collective action against misinformation, and social media campaigns. Next slide, please. Now, from our survey, our research, and our interviews with African fact checkers, we found 3 strategies which were common. And those strategies were to promote self-efficacy to detect misinformation, debunking, and public awareness campaigns about misinformation. Next slide, please. Now, we have 5 evidence-based strategies that fact checkers can consider in the fight against health misinformation. And those include using risk classification to enable more deliberate editorial and fundraising strategies, developing a proactive key message and positive reinforcement around information consumers need to be helpful in a time of crisis, leverage users' social circles to champion evidence-based health information about COVID-19, extend the fact-checking circle of trust by building partnerships with trustworthy media, government bodies, civil society partners, religious leaders, and big tech companies. And the last one would be to promote self-efficacy and empower individuals to take control of misinformation through media literacy and social media campaigns. Last slide, please. Thank you so much. That is all we have for you today. I'm looking forward to hearing your discussions and your comments and questions. Over to you, Stephen.
Great, thanks everybody. Thanks so much for a great presentation. That was very interesting, and many of those things that you raised there in terms of WhatsApp, like you said, they certainly apply to Twitter and Facebook and various other conversations around the world. There's certainly, there's a lot of correct information out there, but there's certainly a lot of misinformation, especially around COVID-19, that's being shared as well. So that's certainly a challenge, and really great presentation and great research that you've done here. I'd like to encourage everybody to ask any questions they have using the chat box or comments about the presentation, or perhaps you've done similar research and you want to share that, and we can address those in our Q&A session. We'll just give people a moment or two to type in the questions. I guess while others are asking their questions, Obviously, it's great that you're sharing your research here with us on this webinar, and that's fantastic. Do you have plans to share it? Like, are you doing a publication, or is there other other ways that you're disseminating the information from this?
Thank you for the question, Stephen. We're actually in the process of writing a paper to be published. So we are in that process currently. And I think earlier on in the year, probably in Feb, we also had a webinar where we launched this particular paper. I don't know if I'm missing anything, Kululeko, maybe?
No, certainly. So we've developed a report for this with all of these findings, and really what we presented here, unfortunately, is limited. In the sense that we didn't go very intense to the findings and all of these things. So there is a publication out. It's a report from our partner organization on this project, Africa Check, which presents the methods. It rationalizes this kind of research, and so much amazing work has been done on this particular project, and it's been amazing, especially at a time when we need this increase in research efforts to help solve all of these problems. So there's quite a bit out there. Perhaps I can share a link to it. Okay, I don't have it open, but I'll definitely share a link should anyone be interested. Lots of amazing work coming out though. Thank you, Stephen.
That's great to hear. We have one question from Kalen. He asked, for method 3, the trend analysis, do you get a sense of who is reporting to Africa Check? And would this skew towards folks who may already have some understanding of misinformation and are likely to know when things ought to be reported or flagged?
Thank you so much for that question. I think true. People who were part of the trend analysis were actually people who have access to Africa Check. But what is shocking is that even though we had claims from those people who have this access, we found that they themselves sometimes don't report this misinformation, but they also get into habits of sharing misinformation and also not critiquing misinformation claims that they actually get. Kululeko, do you want to expand maybe on that as well?
Yeah, sorry, I was actually struggling to unmute as well. So so many things do come out. I mean, I think it's an important question about who is reporting this information to Africa. And as much as we don't have the nitty-gritty details of the who, I think it speaks a lot to self-efficacy and having that backing and being a reliable source, essentially. So Africa Check is very experienced in detecting any kind of misinformation. So, it's a bit difficult to dupe them necessarily. But it speaks to the self-efficacy to, kind of as a human being, knowing the basics, knowing how to, having the know-how in terms of navigating your way around websites or, WhatsApp messages, I mean, a suspicious message to me may not necessarily be a suspicious message to Andy. Sometimes the way that we interact with this information is an important consideration. So, yeah.
And I guess maybe following kind of on that question, would there have been a skew towards certain age groups or anything reporting as well? Or did you find that it was kind of a more broad representation?
Yeah, quite interesting findings on the age groups. Just want to open up the distribution. But essentially, of course, it speaks a lot to the number of users for each sort of age cohort, right? So you do have younger people as well peddling this kind of misinformation, but you also find that, in the older groups, I think we had about 60 and above, we had a 50, between 50 and 59, as well as 60 and above, in terms of our age groups. There were also issues there of simply forwarding messages and, resorting to these behaviors where you don't necessarily praise messages or apply your mind or ask questions. So there was a bit of that. I mean, expectedly, of course, a lot of our respondents were between the ages of 20 and about 40. So interesting in terms of the age distribution as well. As I said, I'll definitely share the link to this report that we've done. There's a more thorough description and explanation on these emerging trends from the research as it stands.
Great. We had a question as well from Janice, who's a patient partner at Evidence. She's curious what you think about WhatsApp being a driver with the misinformation and how this can be better addressed. She said she's seen how Facebook and Twitter are working to tackle misinformation, but that sometimes it's not that effective. And I believe that her last comment is that sometimes it puts hold on the latest evidence as well as misinformation.
I think what makes WhatsApp so complex is because of the encryption. So fact checkers cannot access conversation between two people who are really sharing misinformation or access the groups, because we found that there are some people who actually share misinformation to large groups of numbers because they are part of WhatsApp groups. So I think that is what makes WhatsApp so complex. But I think the mitigating strategies that we spoke about really do also speak to WhatsApp, because if we really promote media literacy and self-efficacy to be able to detect misinformation, it would really work for WhatsApp as well. Because also what we are noting is that sometimes it's just screenshots, really. Screenshots from Twitter, screenshots from Facebook, or maybe a link to YouTube. So somewhat the social media accounts are somewhat linked, so it's not only WhatsApp, but I understand that WhatsApp brings about complexities because you cannot access the conversations that people are having. But really, if we do promote learning and teaching people to be able to identify the misinformation themselves, really, we would have been able to also sort of mitigate misinformation that is happening on WhatsApp.
Yeah, that's a good idea, is having some simple tools. Sorry, go ahead.
If I may just contribute to this, something that I personally feel passionate about is the issue of knowledge translation. And perhaps in some ways, this is where it can also come in, because we don't just discuss language, for instance. There are so many barriers to learning and to understanding science and information that can actually help us save our own lives as well as the lives of our families. So I think within that, there is a conversation about, the extent to which knowledge translation is being broadened by definition, in the sense that it shouldn't necessarily be a very technical concept where only a few people are able to crack it. I think it would be amazing if even lay people were able to understand how to decipher certain information and that sort of thing. So it's one of those things that just make you think when you interact with these findings. Sometimes it's extremely uncomfortable, to say the least. It would be amazing if there were better, more and better platforms to interact with this kind of information.
Just to add that I have attached the report of our work on the chat. So if anyone wants to access that, it's on the chat.
Great, thank you. Okay, I don't see any other questions coming in right now, but I just wanted to thank you both again for taking the time to join us today for a really great presentation. We will be posting a recording from the presentation today on the Copanent site, and we can attach a link to the report as well on there if you'd like, so that people can go and check that out later on. Do you have anything else you'd like to share as kind of a closing statement?
I'd just like to thank everyone who attended today and who gave us a listening. And I really hope that we become the light. You know, sometimes you understand that this is information, this is misinformation, but you are not really active in sort of calling it out and reporting. Can we be the light in our circles? Thank you.
And from my side, a big thank you as well to McMaster for this opportunity. It's been amazing. It doesn't happen very often that we get a chance to share such important research on such a platform with some esteemed individuals, as well as people who have a genuine interest in this. So thank you so much, Stephen, for organizing this as well. We appreciate it. Yeah, maybe from a more personal perspective, I hope all of you are safe, and I hope the pandemic is being reined in your different parts of the world. Thank you.
Well, thank you, and like I said, thank you to both of you. We really appreciate you taking the time to join us here today and being so willing to take part in this webinar. It's like I said, it was a really interesting topic, and I hope that everybody learned a lot from it. And like I said, we'll post this on the Copanent website so that it can be shared beyond today's presentation as well. So thanks again, and hope everybody enjoys the rest of their day. Thank you. Bye.